Your liver does more than you might think. It filters your blood, helps you digest food, and stores nutrients your body needs. But here's the thing. It usually stays quiet, even when it's in trouble. While your heart makes itself known with flutters and chest pain, and your stomach makes noise when it's upset, your liver suffers in silence. But it does send signals, if you know what to look for. After almost 50 years as a nurse, working in hospitals, homes, and military clinics, I've learned to spot the early, often silent signs that your liver may be struggling. So today, I want to walk you through 10 subtle liver warning signs I wish more people over 60 paid attention to. Let's start with what you might notice in the mirror.
The first quiet sign is very subtle yellowing of the whites of your eyes, what we call early jaundice. Why is this quiet? Because it starts so faintly that most people miss it. You might think it's just the lighting, or you might not notice it at all because the change is so gradual. Here's what's happening. When your liver can't process bilirubin, a yellow pigment from broken down red blood cells, it starts accumulating in your body. The whites of your eyes are often the first place this becomes visible, even before your skin shows any color change. What to watch for? Check your eyes in natural daylight, looking at a mirror. Do the whites of your eyes have any yellow tint, particularly near the corners? Ask a family member to look as well. Sometimes others notice what we miss in ourselves.
If you see any yellowing, even subtle, contact your doctor promptly. This isn't something to wait and see about. The second quiet sign is persistent fatigue. Why is this quiet? Because we all get tired. We blame stress, aging, busy schedules. It's the easiest symptom to dismiss. But here's what I learned over decades. When your liver is struggling, it can't filter toxins as efficiently. Those toxins build up in your bloodstream, affecting every cell in your body, including your brain cells. The result is a profound, persistent exhaustion that feels different from normal tiredness. What specifically to watch for? Fatigue that continues even after 7 to 8 hours of good sleep. Exhaustion that seems disproportionate to your activity level. Tiredness that's lasted weeks or months, not just a few days. If you're experiencing this kind of exhaustion, don't assume it's just aging. It deserves medical attention.
The third quiet sign is mild digestive changes, particularly bloating, nausea, or aversions to certain foods. Why is this quiet? Because digestive upset is so common and has so many possible causes. We blame something we ate, stress, or aging. We don't immediately think of our liver. But your liver plays a crucial role in digestion. It produces bile, which helps break down fats. When a dysfunctional liver is producing reduced bile, you might notice that fatty or rich foods suddenly don't agree with you. Foods you used to enjoy might now cause discomfort. What to watch for? Persistent bloating after meals, especially after eating fatty foods. Nausea that comes on after eating, not before. A new aversion to foods you previously enjoyed, particularly rich or oily foods. A feeling of fullness, even after eating very little. In my clinical experience, patients would often say, "I just don't have an appetite anymore," or "rich foods don't sit well like they used to." These were clues worth investigating. If digestive changes persist for more than a few weeks, particularly if combined with other signs on this list, discuss this with your healthcare provider.
The fourth quiet sign is easy bruising from minor bumps or pressure. Why is this quiet? Because as we age, our skin becomes thinner and we expect more bruising. We blame it on aging, blood thinners, or just bumping into things we don't remember. The connection to liver function isn't obvious. Here's what's happening. Your liver produces clotting factors, proteins that help your blood clot properly. When liver function declines, production of these clotting factors decreases. The result is that you bruise more easily, and those bruises take longer to fade. What to watch for? Bruises appearing from very minor contact, like a gentle bump against a table that wouldn't normally leave a mark. Bruises that seem to appear without any remembered injury. Bruising that seems out of proportion to the minor incident that caused it. If you're suddenly bruising much more easily than before, and you haven't started any new medications that might cause this, discuss it with your doctor. It could be your liver's quiet way of signaling for help. The fifth quiet sign is brain fog, difficulty concentrating, or mild confusion.
Why is this quiet? Because we immediately blame stress, lack of sleep, or aging, senior moments, we call them. The idea that our liver might be affecting our thinking doesn't cross our minds. But here's a crucial connection, again, having to do with the inability of the liver to effectively filter toxins from your blood. Those toxins can then affect your brain function. In medical terms, this is called hepatic encephalopathy in its advanced form, but even mild liver dysfunction can cause subtle cognitive changes. What to watch for? New difficulty concentrating on tasks you normally handle easily, feeling mentally foggy or slower to process information, mild confusion about things that should be straightforward, forgetfulness that seems more pronounced than usual. The key is action. If you notice that your thinking feels noticeably different than it was a few months ago, especially if other signs on this list are present, this deserves evaluation. Often, family members notice these changes before the patient does. If someone close to you mentions that you seem forgetful or confused, take it seriously. These cognitive changes are reversible when the underlying liver issue is addressed, which is why early detection matters. The sixth quiet sign is persistent itchy skin without any visible rash. Why is this quiet? Because it seems completely unrelated to your liver. Most people think it's dry skin, allergies, or something they touched. The connection to liver health isn't obvious. Here's the mechanism. When bile acids can't flow properly due to liver dysfunction, they build up in your bloodstream and eventually deposit in your skin tissue. This causes intense, persistent itching that lotions and creams can't relieve. What to watch for? Itching that's worse at night, particularly on your palms and the soles of your feet. Itching that persists despite moisturizing. Scratching that doesn't provide relief. You scratch one area and another area immediately starts itching. Over my years in nursing, I had patients who'd been treating this with various skin creams for months before anyone checked their liver function. Once the underlying liver issue was addressed, the itching resolved. If you have unexplained, persistent itching without a rash, mention this to your doctor and request liver function tests. The seventh quiet sign is a subtle change in your fingernails called Terry's nails. Why is this quiet? Because most people don't closely examine their fingernails for color changes. We notice if a nail breaks or if we have dirt under them, but subtle color variations, those are easy to miss. And the connection to liver health certainly isn't obvious. Here's what's happening. When your liver is struggling, it affects protein production and circulation. This can cause your nail beds to appear mostly white or pale, with just a small band of normal pink color near the tips. The medical term is Terry's nails, named after the doctor who first described this sign. What to watch for? Look at your fingernails in good lighting. Normally, the nail bed underneath should be pink throughout. With Terry's nails, the bottom 2/3 or more of the nail appears white or pale, almost opaque, with only a narrow band of pink or reddish-brown color at the tip. It typically affects multiple fingernails, not just one. The key is the pattern, not just pale nails, but that specific appearance of a white nail bed with a contrasting darker band near the tip. If you notice this change in several of your fingernails, it's worth mentioning to your doctor. It's one of those quiet physical signs that your body uses to signal that something needs attention.
The eighth quiet sign is an unusual change in your breath odor, sometimes described as sweet, musty, or earthy. Why is this quiet? For two reasons. First, you typically can't smell your own breath. You've adapted to it. But second, and more importantly, even if someone points it out or you do notice it, you'll naturally assume it's a dental problem. You'll brush more often, use mouthwash, maybe schedule a dentist appointment. The connection to your liver? That wouldn't even cross your mind. Here's what's happening. When your liver can't effectively break down certain compounds, particularly amino acids and other metabolic byproducts, they build up in your bloodstream and are eventually expelled through your lungs when you breathe. This creates a distinctive odor that's different from typical bad breath caused by dental issues. What to watch for? A breath odor that's unusual and persistent. People often describe it as sweet and musty, sometimes compared to raw fish, or earthy and moldy. The key difference? This doesn't improve much with good oral hygiene. You brush, you floss, you use mouthwash, and the odor returns quickly. That's because it's not coming from your mouth. It's coming from your lungs, which are expelling compounds your liver couldn't process. Here's what makes this sign so quiet. You've been conditioned your entire life to associate breath odor with dental health. It's logical. It's the obvious explanation. But sometimes, persistent breath changes that don't respond to good oral care are actually your liver sending a signal. If you've noticed unusual breath odor, or if family members have mentioned it and your dental health is good but the problem persists, especially if combined with other signs on this list, this deserves medical attention beyond your dentist. Ask your doctor about liver function testing. And don't feel embarrassed. This isn't a hygiene problem, it's a medical clue. The 9th quiet sign is urine that's darker than normal. Tea-colored or cola-colored. Why is this quiet? Because most people don't closely monitor their urine color. We assume if we're dehydrated, we'll feel thirsty. And if urine is dark, we might blame dehydration and drink more water. But if it stays dark, that's significant. Here's what's happening. When your liver can't process bilirubin properly, your kidneys try to filter it out. This excess bilirubin makes your urine much darker than normal. What to watch for? Urine that remains dark brown or deep amber even when you're well hydrated. Think tea-colored or like cola. This is especially concerning if it persists for several days. The key distinction? If your urine is dark and becomes lighter after drinking more water, that was likely dehydration. But if your urine stays dark despite adequate hydration, your liver may be struggling. In nursing, we taught that urine color is an important vital sign. Don't ignore persistent changes. If your urine is consistently dark, contact your doctor for evaluation. The 10th quiet sign, and I know this is a sensitive topic, but it's important, is pale or clay-colored stools. Why is this quiet? Because it's embarrassing to discuss, and many people simply don't look. We flush and move on. But stool color tells us important information about liver and bile function. Here's what's happening. Bile from your liver normally gives stool its brown color. When bile flow is reduced or blocked due to liver problems, stools become pale, almost clay-like or putty-colored. What to watch for? Consistently pale stools. Not just once, but repeatedly. Stools that are tan, gray, or clay-colored rather than the normal brown shades. This is especially significant if accompanied by dark urine. Together, these two signs strongly suggest a bile flow problem. In my nursing career, I learned that patients often felt uncomfortable mentioning this symptom, but it's a valuable diagnostic clue. Medical professionals need to know about persistent stool color changes. If you notice this change lasting more than a couple of days, please bring it to your doctor's attention. It's a medical symptom, not something to feel embarrassed about. If you found this helpful and learned something new today, maybe about Terry's nails, the liver-brain connection, or why breath odor might not be dental, go ahead and hit that like button.